You hear me back there? Yeah, okay. So first of all, I'd like to thank Carmel and Helen for organising a great conference and for the kind invitation to speak to you here today. The title of my talk is Towards Appropriate Prescribing of Psychotropic Medication in Dementia. So essentially I'm just going to give you a quick overview of this issue and drawing on some international evidence as well as our own local research. Okay, so why are psychotropics, or I suppose specifically antipsychotics, used in dementia? Well, as many of you know, as many as 90% of people with dementia will experience behavioural, distressing non-cognitive symptoms at some stage throughout their disease progression. We all know that non-drug therapies, so for instance things like music therapy, pet therapy, simple environmental measures are generally advocated as first-line therapies and should be attempted in all cases. However, it's important not to lose sight of the fact that psychotropics and antipsychotics have an important role to play in certain specific instances. So, for instance, if there's an imminent risk of harm, if the person is severely distressed from symptoms. However, we know from the evidence that psychotropics have only minimal benefits and are often used inappropriately for various reasons and for longer than needed. And this is what we'll explore in this presentation. Okay, so I do like this slide. I think it's really a useful infographic to kind of display the risk benefits of antipsychotics in dementia. So what this infographic displays is that if this is imagine 100 people with dementia who are treated with an antipsychotic. So those in green, so only 20 will gain any benefit. The other 80 in black will gain no benefit at all. And one person, so the person kind of in the bottom right corner, will die or have a stroke as a direct consequence of taking an antipsychotic. So these kind of risk benefits are important to take into consideration when we're prescribing and monitoring these kind of drugs. Okay, so we know that prescribing rates of antipsychotics are high globally, and especially in the nursing home setting, and this is why we're focusing on this in our research. So the US, they're quite good at monitoring these things, so their latest data would tell us that 16% of nursing home residents in the US are prescribed an antipsychotic. In England, this figure is about 19%. Across Australia, around 22%. And a recent study that looked at kind of the average across 12 Western European countries found that the average was about 27%. Okay, so close to home, I know you're asking me how do we compare, what do we like? Well, unfortunately that's a good question and something that we don't really have an accurate figure to. But what we have is smaller kind of local studies, and I think when we kind of pull them together we can tell that, Joe, our figures are high and they're probably a bit higher than our closest neighbours. Okay, so I was involved in a study in Cork, which was led by Dr. Suzanne Timmins, where we looked at the kind of prescribing habits of older people with all older people who were admitted to acute hospitals in Cork. They were diagnosed as having dementia or not having dementia. There's about 600 people in it. And when we compared their medicines for these people that were admitted, we could tell that 14% of people with dementia were prescribed at least one antipsychotic compared to just 5% of those without dementia. Similarly, another research project that from a few years ago, when they went to 14 publicly funded nursing homes across Cork City and County, 37% of nursing homes residents were prescribed at least one antipsychotic. And just another study, some unpublished work by Professor Kathleen Bennett when she was in Trinity. She looked at our national prescribing database, and she estimated that 40% of all people with dementia were on at least one antipsychotic. Now I have an asterisk on that mark because this figure is an estimation, and the limitations of this database kind of assume that all people with dementia were on an anti-dementia drug. So when we say anti-dementia drug, this is things like memantine, donepezil. However, we know that for various reasons, not every person with dementia is on this drug. So it's an estimation. It's probably not. It's probably perhaps an overestimation. But I think what these studies tell us is that there is high usage of these agents in an Irish setting, and it's definitely something worth intervening on. Okay, so I suppose in line with the theme of this conference, I was kind of interested to find out, well, what impact does rurality have on antipsychotic prescribing rates? Obviously, we have no real data in Ireland, but just looking from the international literature, there's not much out there, but some kind of studies that stood out for me. So they did a really interesting study across Australian nursing homes. They had a representative sample of all Australian nursing homes, and they found zero difference between urban and rural settings. So in Germany, community, they have a population level database there, and community dwelling people with dementia. Again, they only found marginal difference, so slightly higher usage in people with dementia living in rural areas, but not significant, only marginal. But I think what was really interesting, and this kind of draws on what Anthea was saying in the last presentation, so Canada, so in, I think this study was done in British Columbia, so again, some quite rural parts of the state, and what they found was in people, community dwelling people with dementia, significantly higher levels of antipsychotics in people living in rural areas. And the authors of this study were kind of surprised, well, and they kind of surmised that it was possibly due to inequalities in terms of access to healthcare. I think this kind of agrees with a lot. So people, so they kind of postulate that it was possibly due to poor access to specialist services that were located in the urban centres. But the authors definitely, they wanted more research to be done to confirm why there was such disparities there. But what was kind of interesting when I was going through the research was that on the flip side then, this study from the Netherlands, this very recent study from the Netherlands, which looked at prescribing kind of nationally in nursing home settings across the Netherlands, and they found lower usage in nursing homes that were located in rural areas. And again, I suppose it kind of surprised me, but the authors postulate that it's because of kind of better working relationships between the professional caregivers and the family caregivers, and kind of almost a community spirit that just they didn't see in the urban settings. So again, I think conflicting data from different nations, but definitely something that's definitely more research definitely needed in Ireland. It'd be great to see the difference between rural and urban dementia in terms of prescribing of antipsychotics. Okay, so going back to my own research, so we know that antipsychotics continue to be prescribed inappropriately, but we want to answer to the question, well, why do we continue to use them if we know that they have minimal benefits? So we conducted this study, and it was published in Jan the last year. It was a systematic review, just collating all the evidence, the qualitative evidence really. The research question is, what are the influences on decision making regarding antipsychotic prescribing in people with dementia, focusing on the nursing home setting? This was a really interesting study. So, we used kind of a very inductive, kind of bottom-up approach to kind of gain novel insights into studies, just to explore their findings. And what we found is that there was 18 studies. We found 18 studies that met our inclusion criteria, conducted across 6 countries: UK, USA, Canada, Australia, the Netherlands, and South Africa. Unfortunately, there was no Irish study conducted at that time. So, what were the main findings? So, essentially what we found is that this was a very complex area, as you can imagine, but the main influences on the decision whether to prescribe or not could be categorized into 5 main concepts. The first was organizational capacity. So this relates to the nursing home organization and its level of resources and access to services, access to those key specialist services. And finally, how the organization coped with severity of illness and behaviors, particularly as they were escalating, how they managed them. Individual professional capability. So what this relates to is the healthcare professionals and the staff members, their level of skills and knowledge in terms of helping and managing behavioural symptoms in people with dementia, what they knew and what they didn't know. Communication and collaboration was quite a fundamental influence on decision making and came up very commonly throughout all studies. So that level of communication and collaboration within the healthcare team itself, and also with family, with the person with dementia. And also clarity of roles and responsibilities, because often prescribing is across different care settings. So it might be someone in the hospital starting, goes to the GP, but who's responsible for stopping once someone else starts it? So very interesting but complex area. Okay, so attitudes. So this was attitudes not just to the person with dementia, but also towards the management of behavioural symptoms. People were very pro-medicine, people were very anti-medicine. We could, very complex, but we kind of categorise into very personal attitudes that some people held, very individualistic attitudes, or more kind of broader kind of organisational kind of culture and societal attitudes. And finally, regulation and guidelines, definitely something that's becoming more and more prominent. And where these were discussed, particularly in the US and somewhat in Australia, they were found to be quite influential on decision making. Okay, so as I said, very little, or well, I suppose there was no Irish perspective, so we wanted to fill that gap. So we conducted our own Irish qualitative research study, mainly across Cork City and County. And I suppose the aim was really to identify barriers and facilitators to appropriate antipsychotic prescribing in nursing home residents with dementia, with a view to informing an intervention. And again, we conducted 27 interviews with a broad range of people involved in the care of nursing home residents with dementia. And I suppose I'm only going to give you the very highlight of this study, but a very complex story emerged, very emotive. Ultimately, I suppose people kind of realised the issues that existed with antipsychotics, but of a perceived kind of desperation and almost like lack of viable alternatives, people resorted to these agents. So GPs often felt pressurised to prescribe antipsychotics. So I'll just give you one quote from a GP. She said, I think people can be a little bit biased in how they can present a case to you at times to get to the ends that they want. I know there has been one incident where a staff member was overheard saying, sure, just tell her she's had hallucinations. Okay, so what this particular staff member realised is that by exaggerating the level of behavioural disturbance, the likelihood of a prescription would be increased, and hence maybe her life may be made a bit easier, unfortunately. So on the kind of flip side of that, understandably this is a very emotive and challenging topic for our people, and people really struggled with this issue despite knowing what they know about the drugs. And one family member, in relation to the care of his loved one with dementia, said, so it was very hard to listen to these behaviours and these symptoms, and so as far as I'm concerned, if there was any medication that would sort this thing, I was completely open to it. So as you can see, very difficult, complex topic, but some definite barriers and facilitators that came through. And I suppose this leads us to where we are now, and I suppose in my own research, we've based on kind of the qualitative evidence and speaking to various professional stakeholders, and also with great input from the Irish Dementia work groups, of working with people like Helen and Carmel, really looking to develop an intervention. We've developed this intervention, which we have piloted down in Cork, and it has quite promising findings. So the intervention that we have developed is called the RAPID study. So it stands for Rationalising Antipsychotic Prescribing in Dementia. It has three main components, and based on education being the main component of it. So the number one was education and training with the nursing home staff, focusing on appropriate use of antipsychotics, but also reinforcing the principles of person-centred dementia care. Number two, we did some educational outreach with the GPs. It's very focused, brief sessions, because we all know GPs are very busy. So focusing on best practice guidelines for antipsychotic prescribing. And also part three, we introduced an assessment tool into the nursing home environment, just to try and kind of help and prompt nursing home staff with the assessment of behavioural symptoms and how to manage them, and maybe what symptoms are likely to respond to antipsychotics and those that are not likely to respond to antipsychotics. So just getting the balance right. So as I said, we're fortunate that there's several other things ongoing, policy and practice interventions ongoing in Ireland at the moment. So under the remit of the National Dementia Office and being led by Dr. Suzanne Timmins, who's here today, and Professor Stephen Byrne, we are developing national clinical guidelines just to help prescribers and nursing home staff to prescribe these agents more appropriately, and that's quite an interdisciplinary team developing those guidelines, and we're fortunate enough to have Helen on board and Ronan Smith and many other carers and many other disciplines developing these guidelines, and we hope to have them developed by the end of the year. And also just to mention the Prepared project, which is another really great project being led down in UCC by Dr. Tony Foley. So that's focusing on kind of upskilling GPs across management of dementia in general, but I mean one of their key focuses is really to help GPs with this issue of antipsychotic prescribing in dementia and how to make it better. So just to summarise then, we know that psychotropic medication use is highly prevalent, not just in Ireland, but quite internationally, despite limited benefits and potentially serious side effects. they continue to be inappropriately used, and for a multitude of complex reasons. And it's not just because of understaffing, or that is a key issue, but it's not just because of that. Lack of knowledge does play quite an important role as well, and attitudes. Further research and policy efforts are needed to help us move towards appropriate. I said we're not there, but we're getting there. So just more needs to be done. But as I said, we're making slow but sure progress. So just like to thank everyone for listening. Enjoy the rest of the conference.